Hello and welcome, everybody. I'm Lucas Livingston, the Executive Director of Chicago Hyde Park Village. It's a real pleasure to have you all here and a great pleasure to welcome Dr. Hanna Molla, who is going to speak to us today on the topic of what you want to know about THC and CBD for older adults. So all the questions we have, but maybe are afraid to ask. No. Dr. Hanna Molla is a staff scientist in the Human Behavioral Pharmacology Lab at the University of Chicago, in postdoctoral training under the mentorship of Dr. Harriet DeWitt, and is interested in studying the neural and cognitive effects of drug use in humans with a particular interest in cannabinoids. So really wonderful to have you here with us, Dr. Molla, and we'll dive right in. And people certainly are welcome to use the chat. If you have questions, you can type them into the chat or hang on to them until the end of the conversation. And we'll definitely have some time to get to Q&A towards the end. All right. Thank you very much, Dr. Molla.
All right. Yeah. Thank you so much for the nice intro, Lucas, and thank you all for having me today. It is I'm really excited to talk with you all today, and I think it's a very relevant topic, both THC and CBD with the recent legalizations over the past few years, and just this increased interest in it overall, and so. Yeah, so I'm happy to be talking about this with you all today. As Lucas mentioned, I work here as a researcher at University of Chicago with Harriet DeWitt, and we conduct studies in human trials looking at the effects of various drugs, one of which being THC. And yeah, so I'll just go over a bit of some pertinent information that I think will be useful to you all. And if you have any questions or anything, you can feel free to ask. I know Lucas mentioned that we would be saving questions potentially towards the end, but if you need any sort of clarifying, like you have any quick questions or anything like that, feel free to jump in and ask. Okay, so to start off a little bit about cannabis. So we're all pretty familiar with what cannabis is. Cannabis, also known as marijuana. So it's a dried cannabis plant, contains over 100 different cannabinoid compounds in them. And the most popular, I guess, cannabinoid compounds, so the most popular ingredients in the cannabis plant are THC and CBD. So what exactly is THC? So THC, also known as delta-9 tetrahydrocannabinol, it's the main active ingredient or the main psychoactive ingredient that's in the cannabis plant. It is the ingredient that is responsible for that feeling of a high that you get if you ingest cannabis. And it has all of the usual effects that we're all familiar with. So it can alter perception, thinking, mood, increase appetite, all of those things. And so what exactly is CBD? So again, CBD is another compound that is found in the cannabis plant, but it's a non-psychoactive ingredient, and it doesn't produce any sort of intoxicating effects at all. Over recent years, there's been a lot of the CBD present in a lot of like topical agents and products. And it has gotten quite a bit of attention over recent years, particularly for having some potential therapeutic benefits. But does it really work? And so I do have some slides a little bit towards the end that have some more information about this. But kind of short answer is that, from a lot of the well-conducted human trials that have been conducted over recent years, there really doesn't find there really isn't much evidence supporting any sort of beneficial effects with CBD. THC is a little different, and I'll explain that in a few slides as well. So in terms of legalization, where are we at these days on a nationwide level? So ever since 2012, when the first states, Colorado and Washington, passed legalization to um, legalize recreational cannabis or in marijuana, now there are about half of the states in the nation, including Illinois, where both recreational and medical marijuana usage are legal. And from doing a quick Google search, it looks like there are about 15,000 dispensaries nowadays, which is a huge number. And so this is a map showing some of the active recreational dispensaries within the Chicagoland area. So there are 25 of them from what I could find online. And the orange dots are the recreational only dispensaries, and then in purple are the dispensaries that are both recreational and have where you can purchase medical marijuana as well. I don't believe there are any differences in terms of the products that are in the dispensaries. It's just a matter of I think with medical marijuana, you're able to sort of bypass some of the more heavily taxed recreational for recreational purchases, basically. But what's interesting and what I didn't notice until I looked at this map was that there really aren't any dispensaries within, the Hyde Park area. And I'm not really sure why that is. The closest ones it looks like are just one that's a little further south of South Shore, and then a couple maybe in the South Loop area. But for the most part, there really aren't any dispensaries nearby. I mean, I know that there are, certain regulations in terms of how close a dispensary can be to certain places like schools and daycares and all of that. But yeah, I just thought it was kind of interesting that there aren't any nearby. But not too far away. So the closest one you can probably get to in about 15 minutes or so. And then, what kinds of products can you get if you go to the dispensary? So there are a ton of different products that are commercially available through the dispensaries. So this is pulled up looking at a couple of products that are available that was shown on some website related to some dispensaries nearby. So there are, many different categories. So I think we're most familiar with the cannabis flower plant that can be purchased as well. So just the flower, the buds that you can find at dispensaries with varying concentrations. Typically, the maximum concentration of cannabis that comes from the plant is 25-30% or so, and anything less than that. And then you can also find pre-rolled joints as well at dispensaries. So I guess it takes a little bit of the work away for you, and is a little more easily accessible in that manner. And this again, they are filled with the flower extracts, so they're typically the highest in concentration are about 25-30%. And then you can also get these vaporized these cartridges that or extracts that have extracted THC and CBD from the cannabis plant, and they're in the form of like an oil or even like a wax. And these have much higher concentrations of THC in them. So I've seen anywhere from 40 to even 95%. So it can be pretty high. And, that is something to sort of look out for. I think this is what people who use a little more frequently may use, because their body probably is a little more tolerant to it. But at really high doses, that's when you're likely to experience some of the more negative side effects. So that is, something to look out for. Um, and you can also purchase THC infused edibles that, not only come in the form of gummies, which I think people are most used to seeing, being advertised, but lots of different forms as well. And even THC infused drinks. And these can all come in varying concentrations or doses of THC or ratios of THC and CBD. And in terms of CBD products, so after 2018, there was a bill that was passed where hemp, which is a plant that is very similar to cannabis, but just has very little THC in it, that no longer became a controlled substance. And um, uh, so any sort of products that are derived from hemp, so CBD derived from hemp, could be sold and purchased basically anywhere. And so there are a lot of different, so you can go to a retail store, you can purchase it online, or even at dispensaries as well. And CBD products typically come in the form of like topical agents, so body oils, lotions, tinctures where you could put drops under your tongue. And these are all with varying concentrations of CBD, or various doses of CBD as well as THC. And these are just examples, again, that I pulled online from a website, a dispensary website. And so I think because, it's not as, none of these products are FDA regulated, some things to look out for are that, just because it says that it has 200 milligrams of CBD in it, is that really the case? And I have some slides later on that will show some information regarding that what's on the label isn't necessarily what's actually in it, because it's not so well regulated. And so that's something to look out for as well. Um, so so THC itself, for the components of within cannabis, has really changed throughout the years. The potency of cannabis, so the amount of THC within cannabis, has really increased pretty steadily. So the cannabis that was being smoked back in the 60s and 70s is definitely not the cannabis that is being smoked today. So this graph here is from a study that was published in 2016, where this research group was able to get their hands on almost 40,000 samples that had been collected by the DEA, and they processed those samples and analyzed them. And they found that on average, samples from the mid 90s only contained about 4% of THC in them on average. And then, that as of 2014, that number has sort of steadily increased to THC, the percentage of THC within the cannabis plant being about 12% on average. So it's a huge jump. And I think they updated the study just, within the past couple of years. And now I think it's at about 14% on average. And so, these are things to sort of look out for, because again, the more you increase the dosage that you may be consuming, the more likelihood it is that you may experience some of the negative side effects. And so, those are things to be aware of. So in terms of, I'm going to try and move my screen up a bit. I can't really see. Okay. Okay, so in terms of, the effects of THC can really depend on a number of different factors. So, what you end up experiencing can be dependent on a number of different things, one of which being route of administration. So by far the two most widely used methods of ingesting THC are through inhalation, whether it's through smoking or vaping, as an oral ingestion. So either, taking edibles or capsules or stuff like that. And so those are the two main methods, and there are, pros and cons to both, depending on what, you know, your the reason as to why you may even be using to begin with. So with inhalation, the THC can be absorbed through the lungs and get into the bloodstream pretty quickly. And so the effects you can start feeling effects very quickly. So within a matter of a couple minutes or so. And the peak of the effects typically occur about 15 to 30 minutes after smoking. And the effects can last for about 2 to 3 hours or so. And in terms of controlling the dose, though, it's a little bit difficult with smoking because it depends on a number of different factors. So how many puffs you take, how long you hold it in for, all of those different things can affect how much of the THC ends up in your bloodstream, and so you may not be able to tightly control the dose that you're consuming. But if you're ingesting it orally, then you know exactly how much you're taking. But the effects for oral ingestion actually take a while to occur relative to inhalation. So you won't really start feeling any effects for about 30 to 60 minutes after you ingest it. And the peak of the effects, occur roughly about 2 to 3 hours later and can persist for a lot longer than if you are inhaling it. And so, titrating the dose can be a little more challenging because of the fact that the effects, take a while to kick in. And so these are all sort of things to take into consideration if you are, planning on using. And one other method that is somewhat used but not as frequently is through oral mucosal. So the oral sprays or the tinctures where you just place droplets under your tongues. With this, the effects, it's sort of an in-between of inhalation and oral ingestion. So the effects start to kick in a little more quickly than if you're ingesting it orally and it, is being absorbed through the stomach. Um, and then topical agents, I don't really see that as much with just solely THC products. That's more seen with CBD. But of course, like the effects are going to be more localized to the area that you're applying it to. All right. So in terms of dosage, it's kind of a difficult question or it's sort of a difficult thing to sort of address because there really isn't like a standardized dose across, the field in general. So when you're looking at literature and people are, trying to see whether THC has an effect, they're testing multiple doses, and the route of administration can really have an effect on what the right dose is. But in general, with inhaled THC, those products, they really just tell you the concentration of the product that you're consuming. So you don't know like the exact milligram dose that you'll be taking in with inhaling it. But the point of this is basically that you really need less THC if you are inhaling it relative to if you're just taking it orally. Because if you're taking it orally, you may just need a little more because it uh, less of it ends up in the bloodstream, basically. Some of it gets broken down as it's being absorbed through your gastrointestinal system. Some of it gets broken down into your liver before it gets into the bloodstream. And so to feel an effect through oral THC, I think you would need at a starting dose, maybe about 5 milligrams or so to feel a detectable effect. So this table that I got here, that's placed here, is from a publication that did collected data from a bunch of different studies. And it's not really, an exact determination. Of course, there are a number of different factors that can come into play to determine what a low dose might mean for you. You know, how frequently you use, how well your body does at metabolizing THC can, you know, have an influence in terms of what type of effect you might feel. But in general, you know, lower doses, if you're ingesting orally, tend to be anything less than 7, 8 milligrams or so. And a medium dose would be anywhere from 8 to 18 milligrams, and a high dose would be anything greater than 18 or so milligrams. But again, you know, this is just sort of like a rule of thumb, not any sort of strict guideline or anything like that. And again, you know, it all sort of depends on why you are interested in using to begin with. Is it, you know, to help alleviate pain or anxiety? So yeah, all of those things should be taken into consideration. You know, what types of effects can you feel if you do ingest or take in THC? You know, so I think it's pretty widely known, you know, that in terms of cognitive effects, you can see some changes in terms of attention, memory, some executive functioning, so some cognitive effects can also affect your appetite, your mood. And in terms of physiological effects, uh, d- you can see some changes in your reaction time, your coordination, some transient increases in heart rate as well. Um, and in terms of clinical applications, so is THC used clinically? And the answer is yes. Uh, so there are only two indications, though, in which the FDA has approved THC for treatment, and that is chemotherapy-induced nausea and AIDS-related weight loss. The THC comes in the form of the medications dronabinol, or also known as Marinol, and nabilone. These were FDA approved back in the 80s. I'm not exactly sure why, like these are the specific indications that that have been approved for through the FDA, but that is something to be aware of. So, you know, it does help with nausea and vomiting, and it does help people gain weight as well because of its effects on appetite. Um, but is THC also helpful for other things? And there have been there have been a number of you know, well-controlled randomized studies that have looked at the effectiveness of THC in not necessarily curing any sort of conditions, but in alleviating some of the pain, chronic pain that are associated with a lot of conditions. So chronic pain is a thing that that medical cannabis is used for. So, you know, with medical cannabis, there are a number of different conditions that you can use cannabis for, that, you know, the doctor can recommend and provide people with certificates or cards. I'm not sure of the exact process with medical marijuana cards, but there are a list of conditions that it is that you can use it to help treat. So again, so chronic pain is, I think, by far one of the most where medical cannabis is most widely used. And again, it's for a number of different conditions. So, you know, neuropathy, arthritis related conditions. There have been muscle spasticity associated with MS, Crohn's, glaucoma, just to name a few. And so there have been some pretty substantial evidence showing that that THC can help alleviate some of the symptoms that are related to it, to these conditions. Um, In terms of some common side effects that you might see, so again, transiently, you can see some increases in heart rate after THC is consumed. So, if you do have any sort of cardiovascular conditions, hypertension, arrhythmias, or anything like that, I would definitely encourage you to speak with any sort of healthcare providers to sort of, understand possible risks and sort of determine whether it's right for you. Um, uh, Other side effects, people can experience some facial flushing, some abdominal pain, a bit of dizziness. If you're taking higher doses of THC, some people that are predisposed to having, psychotic symptoms, there is a possibility of experiencing psychotic-like symptoms, high paranoia, high levels of anxiety. So those are things to look out for. And again, that is when you start getting into the higher concentrations of THC. And there's also potential for addiction. So cannabis use disorder is a thing, and it's very similar to other substance use disorders. So if people can end up developing a dependency towards to cannabis, or which contains the active ingredient of THC. So those are things to definitely look out for. In terms of possible drug interactions, so THC, it's metabolized by primarily metabolized by two enzymes in the liver, CYP2C9 and CYP3A4. There are a bunch of other medications that can affect how these enzymes work, or how well these enzymes can break down drugs. And so it can potentially cause some interactions, and it could potentially increase the effects of THC if you're using drugs that are known CYP2C9 or 3A4 inhibitors. So that's one potential interaction. Other interactions are more related to the effects of THC when the it sort of already, can cause dizziness and a bit of confusion and sedation on its own. But if you're combining it with central nervous system depressants like alcohol or benzodiazepines, it could sort of further these effects. And so that is something to keep in mind as potential drug interactions. And another potential interaction could be with other drugs that have cardiac effects. So other drugs that could potentially increase heart rate. You can have like these additive sort of effects, and so that is something to keep in mind as well. Okay, so moving on to CBD now. So again, CBD, cannabidiol, it is another compound that is found in the cannabis plant, but it is that compound that doesn't produce any sort of psychoactive effects. So you don't feel high from CBD if you're taking that alone. And it doesn't really have any of those mind-altering effects. As of recent years, there has sort of been like an increase in interest of using CBD to help alleviate some symptoms surrounding various conditions like anxiety and insomnia and pain, as well as helping with inflammation. But there really hasn't been a lot of evidence to support, particularly in human studies, to support much of any of these findings. So I work in Harriet DeWitt's lab here at University of Chicago, and she is an adamant believer that CBD is that any sort of effects that people may be experiencing from them are really just placebo effects in and of themselves. She's conducted some studies in the lab before my time here, where they they administered various doses of CBD, pretty, I think, pretty uh, substantial doses of CBD to people, and they just didn't find any sort of effects with them. And these were, in blinded conditions where people didn't know what it was that they were taking, and there were placebo controls that they could use to compare the results with, and they just didn't find much of any effect. I was also kind of, sifting through the literature as I was preparing for the talk as well. And from the studies that I've seen where they've, combined THC with CBD to see if there are any sort of effects, because people, there are also claims that that CBD may be offsetting some of the negative effects of THC at times if you're using it in combination with one another. But I just haven't been able to find any studies that have really substantiated these claims. And so, I mean, not to say that, yeah. So maybe more research needs to be done is one thing. But as it stands right now, there doesn't really seem to be much of any an effect with just CBD alone. Uh, Except for in the case of it is approved. There's a drug called Epidiolex, which is a synthetic form of CBD, and that is used to treat certain conditions in pediatric patients, epilepsy-related conditions. So it can be effective as an anti-seizure medication, but specifically for these small subsets of epilepsy disorders. And so, yeah, so not so much relevant in other cases. So, in terms of side effects with CBD, it is pretty generally well tolerated and pretty safe overall. But it can cause a bit of fatigue or nausea. But in general, even at high doses, it is pretty safe. Um, and potential drug interactions of CBD, though. So CBD can reduce the activity of the liver enzyme CYP2C19, which is used to break down, a number of different drugs, including, I believe, certain like SSRIs and SNRIs. And so it can interact with the body's ability to metabolize drugs that are metabolized by CYP2C19 if you're using it at the same time. In terms of how much of a dose you might need in order to actually see an effect, I'm not exactly sure, but these are things to be aware of in terms of possible drug interactions with CBD. And I think this is the one of the last slide I have. It's just goes over a little more information about the products, both THC and CBD products that you can find, at dispensaries as well as online and in retail stores. Because most of these products are not FDA regulated, if it's not dronabinol or nabilone, the FDA approved medications to treat those specific indications, then it's there are requirements in terms of how the products that are being sold at the dispensaries as well as that are commercially available. There are requirements in terms of labeling. They have the concentrations of THC and CBD have to be explicitly stated on the labels. But in terms of whether they accurately reflect what's in the product, is sort of a bit of a different story. And I think it's because of the fact that it's not as tightly regulated. And so this data here at the bottom of the slide is from a study that was published in 2022, where this research group, they just purchased a bunch of CBD from various retail stores, online, and everything. And they tested the samples. I think they had over 100 different samples. And they processed them, analyzed them to see what was the content of CBD in them. And they found that 18% of them had less CBD than what was claimed on the label. And this was in terms of less or more amounts, it was anything greater than 10% of what was stated on the label. So only about 18% or 18% had less CBD than what was claimed. Almost 60% had more CBD than what was claimed on the label, and only 24% of them were accurately labeled. And I did find another study that looked at the amounts of THC in various strains of cannabis plants that were being sold at dispensaries. In this study, it was they looked at dispensaries in Colorado. So they went around and purchased a bunch of THC from these dispensaries or cannabis plants, the flower from these dispensaries, and they looked at they analyzed the concentrations of THC in it. And for most of them, there was much less THC than what was actually than what was on the label. And so, these are things to sort of take into consideration and to sort of, just know about. I was kind of surprised to see that myself, and as I was, going through and reading up on all of this. And so, these are all things to sort of take into consideration when we're thinking about the safety of these products that we may be using. Is it actually is what is on the label exactly what is contained within the product itself? Yeah, so that is basically everything that I had on my slides. And yeah, I'll go ahead and maybe stop sharing now, and we can talk if there are any sort of questions. How do I stop?
Wonderful. Thank you, Dr. Molla. Yeah, if anybody has any questions, don't hesitate to unmute yourself, chime in, or you can raise your hand through Zoom and we can take a look at that, or post it in the chat, whichever way is preferential for you. Don't have any immediate questions right away, but do feel free. Don't hesitate to chime in. I guess part of me is wondering is if there's such a difference in between what's on the label and what is actually in there in some cases with CBD. What do you think is that accidental on the part of the manufacturer? Is it hard to, or is there some? You would think, especially if there's more CBD in there than what's on the label, it wouldn't be intentional. It might just be that they don't know how much they're putting in. Can they not measure it? I don't know.
Yeah, I mean, I think I would agree. I don't know if it's necessarily intentional. I think part of it really just might have to do with uh, if you're putting a drug through with the FDA, like it has to go through rigorous testing in terms of what is within it. I think you have to go through like a sort of certificate of analysis. So you have to submit your sample to, a well-verified lab that can actually that has like a standardized protocol in terms of how to analyze the components within it. I just don't think the standardization is there. And so I think that might be why there's a lot of variability in the products. I did in that study that with the data that I showed, they looked at they sort of categorized each of the different CBD products, and so I think they had like lotions, balms, patches, and the one product that kind of showed the most variability were the lotions. So maybe it has something to do with what is like how I guess that's being processed or made in batches or something. The patches actually had the least amount of variability and were fairly accurate. And so that's sort of another thing. So my guess is it just probably has something to do with how it's being manufactured, but I'm not sure.
Sure, yeah. I see a couple hands raised here.
Yeah.
Diane, go ahead, please. Isn't your
So
hand?
I was just wondering, my question is about depression. Do you have any comments on seniors and using the THC for depression? Any comments on that?
Yeah, I don't know if that's really been, surprisingly, I don't know if that's been as well studied. I know that with THC and anxiety, so another, sort of related mood related condition, lowered their THC sort of has a biphasic effect, meaning that at different doses, it can have different effects. So lower doses tend to be a little more anxiolytic, so tend to have more alleviating effects with anxiety, and higher doses can sort of enhance anxiety. So I wonder if there may be some dose dependent effects with depression as well, but I don't know if there really have been too many studies with, a large number of people that have really had any sort of substantial findings with depression, particularly within older populations either. I don't think that research is out there.
Yeah, we do have a few questions here. I see Ina Grace has her hand up, and then was it mentioned Helen? Did you have a question? And then I see a question from Noelle in the chat. So let's just go in that order. Then Ina Grace, if you want to unmute yourself and take the question, you need to unmute yourself there, Ina Grace.
Okay, there.
There
The
we
little
go.
that I know and listening to you, I would be very leery of using any cannabis products. Now, I think the one thing, if I had chronic pain, which fortunately I do not have, but it seems to me that maybe for chronic pain, but I probably would go to my doctor, my primary care doctor. But it just seems like there's very little, well, there's some studies, but it seems like it really needs to be studied more. And then if you can't depend on what the label says, which I would think would be an FDA issue. So I guess I still remain very skeptical of whether I would ever consider using any of these products.
Yeah, it's I agree. There does seem to be a bit of a gray area in terms of the regulations with FDA and the labeling of these products. And I think that if things change sort of on a federal level in terms of legalization, or if cannabis itself, like what they did with hemp, how that was removed from the controlled substance list, yeah, maybe there will be a more standardized way of regulations at some point, but we're just not there yet. So yeah, I agree with your weariness.
I have a question.
Ellen, yes,
Yeah.
please.
I'm sorry, I was on mute. Thank you very much, Diane. You helped me. It's not a question, it's really a statement. I have been using CBD for 5 years. I have awful arthritis in my hands, my hips, it's everywhere. My doctor has no problem with me using it. It relaxes me, it helps me sleep. And the cream, I use the cream and I use the gummies, and the cream does help more than anything. You rub it on, it won't take it away completely, but it definitely takes the edge off, which sometimes is a great help for me. So
Yeah,
just
I
wanted
mean,
to.
yeah, no, thank you very much. And I think the good thing, yeah, with CBD, there really are very few side effects, if anything. So if it works for you, then yeah, for sure. I think that's good.
Helen, can I just ask a question? What dispensary do you use?
I use Zen Leaf, and it's in Pilsen. It's on the corner of Milwaukee, and I'm not familiar with the area because I get a ride.
That's okay.
But you can go into any dispensary and get it. I have a medical card, not for THC, but for the CBD, because I get a 25% discount and you don't pay taxes. So you do save a lot with that medical card. If you don't have the medical card, you can still buy CBD but you won't get the 25% off.
Thank you.
Yeah, I did not realize that it was such that the recreational THC was so heavily taxed. It's quite interesting, but
Not,
um,
yeah, not, if I said THC, I meant CBD.
right,
I
CBD.
haven't done
Okay.
THC since Woodstock, so.
There's a question from Noel in the chat. Have you reviewed any studies on the efficacy of CBD when combined with small amounts of THC?
Yeah, so I think most of the studies sort of point towards the effect really the effects of THC of the with the drug when it's in combination with THC and CBD, primarily just being with THC. So, if they have if you have a group that is just taking CBD, a group that has a ratio of THC and CBD, maybe equal concentrations, and then THC alone, the group that has just CBD sort of shows very minimal effects. So the effects really lie when THC is sort of present, is what has been found in for most of the studies that I've
Maybe.
come across.
Hmm, okay.
I have one more question, if you don't mind. I've heard a lot. My doctor told me to stay away from terpenes in THC. What are they? Do you know?
Yeah, so that I don't know as much about that, but yeah, those are other compounds that are found within the cannabis plant as well. So again, there are over 100 different cannabinoids that can be found within the cannabis plant, and there are research groups that are sort of studying all of the various ones out there, because there are a lot more than just THC and CBD, and terpenes are also part of that, the chemical compounds within it as well. I don't know much about them and their effects, but from what I've read, there seems to be maybe some synergistic effects with THC as well when it's combined. But yeah, unfortunately, I don't know as much about the terpenes. And did they state why?
No, he just told me to stay away from it.
Interesting. Yeah.
So I do.
Yeah. All right. Well, he may have some reasons for it. So
And oh no, there was a comment on the terpenes in the chat there. Terpenes
Oh,
from
yeah.
Noel. Terpenes are in all plants, so we eat
Oh,
them as
wow.
vegetables. Hmm.
all right. Good to know.
And Sal, it looks like you have your hand up. Do you have a question?
Yeah, I did have a question, and people were expressing skepticism and everything, unless you have chronic pain. I have chronic pain and also kidney disease. So I'm very limited on what I can take. All I can take is Tylenol, which is like chewing gum or something. Okay, it's kind of but no NSAIDs. And obviously for chronic position, I'm waiting for surgery, bilateral hip replacement. I'm not going to take narcotics because duh, so it's really limited what I can take. So that's why I tried some CBD that a doctor recommended. But I don't know what I'm doing. So I don't know if I got the right amount. I tried dronabinol through my psychiatrist, 2.5 milligrams, and it felt too strong. And I even tried
Okay.
cutting it, and it was like, oh, you can't do it because it's an oil. So, oh well.
Yeah.
Because it just felt too strong and I wasn't comfortable. Isn't that weird? But anyway.
Interesting.
So
Okay. So
that's good to try, heroin would be good. I'm kidding.
I hear you. Yeah, no, it's so the dronabinol, you were taking that. So it was in the capsule form but it has the oil inside of the capsule.
Yeah, and it has a good capsule, and it was so hard to get. It was like I was trying to get uranium or something. I swear.
Yeah, we're trying to start a study right now with THC, and it's on a shortage. And they said it probably won't be available for 4 to 5 months or so. So yeah, I don't know where it's all going, but apparently there's quite a shortage.
I was amazed at how hard it was to get, just period. Some places didn't have it, then some places had it for a few minutes, or something like that. It was weird.
Well, yeah, I mean, I hope that, you're able to find something that works with you. And yeah, and I think 2.5 milligrams is sort of the lowest dose that you can get too. So
I know,
yeah.
kind of funny, but I was interrupted and I feel bad about that. But DeWitt, I'm sorry, I'm just calling her that. She feels fairly strongly that the CBD effects are placebo related, the positive effects people feel.
Yeah, and that's really just based on the studies that they've conducted in her lab. I think, like 2015, 2018-ish. So yeah, and a number of other studies as well from other labs that use, the gold standard for human trials is double blinding it, so the participant doesn't know what they're receiving, the experimenter doesn't know what drug the participant is receiving. You have a placebo control, and then you test the effects, and under those conditions, it's the effects are just not there.
Except a placebo effect is still a
Right.
relief. I mean, it's still
That's
help.
true.
It's true.
But
That
I
is
think
very
this is good. I mean, as I said, fortunately, I don't have any conditions yet that I would go to marijuana, but I think it's good to hear from other people and their experiences. And this is just not something you sit down at lunch and say to somebody, okay, have you been using marijuana? How does it affect you?
Yeah.
So thank you, Helen and Saul, for sharing
Yeah.
your experience.
Yeah.
Well, thank you for letting me.
Hey.
Yeah, I mean, I completely agree. If it works for you, then I don't see the point in stopping, because again, the side effects are so minimal. I mean, are
Yeah.
negligible basically. So, if you feel effects, then yeah, I think that's great. And, it's hopefully can help alleviate some of your symptoms. So
Yeah, they have a million different kinds. They have stuff to relax. They have gummies I do the gummies. They have gummies to take anxiety away. I'm not saying all that really works. I think it depends on your mental state too, the time that you're taking it. But I know that it does relax me sometimes when I'm anxious, and my doctor says it's okay. So that's good. He even told me to help me sleep, I could get a gummy of like 5 milligrams of THC, and that would knock me out for the night and I would have no pain. So it's kind of contemplating in my mind about that, but I haven't asked my doctor that. Well, he did say that a very low dose. So
yeah, I mean, 5 milligrams is definitely on the lower end of it. So yeah.
Yeah, well, I'm of the generation, which is, I guess some of us anyway, just skeptical of drugs, and so I've heard growing up hearing so much bad stuff about marijuana. It's kind of difficult to shift and to think that there might be some good effects. So I hope that people continue to study and to share.
Things really do change when you have excruciating pain that prevents you from going outside.
Yeah.
Suddenly you're willing to say, what about that guy in the corner in South Shore? Can somebody go, I'm joking about that also. I work in recovery, but, I can't, and I wouldn't do that because I'm scared of that kind of thing. But it does change, because it's like, I want a life. So I think it's good to be cautious about it, though.
Yeah. Yeah.
Really.
Very
Finding what works.
Mm-hmm.
And so I guess certainly asking one's doctor and just walk into a dispensary and learn more, right?
yeah, absolutely.
Yeah.
And you would be surprised how many seniors are in the dispensaries. There's more seniors than there are young peoples when I go. Because I go
Interesting.
when I get the 25% off, of course, you know.
Does
So a lot
anybody,
of seniors are on it.
yeah, I'm curious as to why there really aren't any dispensaries in the like the Hyde Park area. Does anybody know much about that or?
Mm-mm.
Well, I wasn't being facetious when I said that the University of Chicago probably has something to do with it in terms of students and making it a little bit more difficult to get. There's not as many on the south side as there are on the north side in Andersonville and all these, different places. But that's just my opinion, that let's make this a little bit more difficult. It's supposed to be the place where fun came to die, University of Chicago. Why would you bring something,
But
Yeah,
yeah,
it's not
it wasn't just Hyde Park. It was really on your map. It was really the whole South Side.
south side.
outside, yeah.
Yeah. Yeah, I thought that was interesting.
Yeah. Okay.
Good. All right. Well, if there aren't any more questions, we can begin to close this up. But again, thanks so very much,
Thank
Dr.
you.
Molla. Really
Yes, thank
interesting.
you.
Thanks everyone for
Yeah.
contributing. Great conversation. Very informative. Looking forward to this.
Thank you all so much.
How it
Thank
develops,
you.
continues.
Thank you for coming.
Thank you.
Well, thanks everybody. And we look forward to seeing you around and have a wonderful rest of your day and rest of the week. And yeah, thanks again, everyone. Thank you.
Thank you.
Bye.
Care.
Bye.
Bye-bye.